Great. All right, so we have opened up the weight room and they are coming in now.
Good morning, everyone. Or good afternoon, I guess, officially after 12.
Hello.
Alexia, are you gonna give it a few more minutes, or do you wanna greet it? Are we getting started?
I will give it a minute and then we will get started. Oh, I see a bunch of names that I recognize. Hi, Michelle. Hi, Cecile. Nice to have you all join. And Susan, I know you've joined before as well. It's great to have you back. Hello, Felicia. Hello, Jinping. Okay, I think we're going to get started. So welcome everyone to our monthly roundtable. I am so excited today because Ana Kertesz is going to lead our roundtable today, and a very, very exciting topic. Before we get started, we normally do a roundtable introduction, which often can take some time. So what I'm asking everyone is please go to your profile. I think there are the 3 dots, and rename and put your name and your class in it so that we know who's there at the end of the line. If you can please do that, that would be wonderful. And I just very, very briefly want to introduce Ana, who has very kindly volunteered to help out with the roundtables as well, and is taking a lot of responsibilities. So she's my partner in crime, and I'm tremendously happy about that. So Ana has just started an investment management company and has a wonderful background in finance and acquisitions, and is going to speak about, I think, a lot of healthcare innovations from a global perspective. I am probably cutting her introduction very short. She's a very accomplished individual, but I really want to make sure that we have time, not only for the speakers in the panel, but also for plenty of Q&A. And lastly, before I truly hand over the baton, I also wanted to make a quick note about the LinkedIn and WhatsApp groups for the Healthcare Roundtable, very specific to our roundtable. And I'm hoping that we can all engage. I know I've been floored by the talent that we have amongst this group, and it would be wonderful to keep the conversations going. So with that, I'll turn it over to Ana.
Hi, everyone. Good morning or good afternoon. Thank you, Jagrudi, for allowing me to have this opportunity to talk about what I've been obsessed about for a while now. My name is Ana Kertesz. I'm originally from Brazil, and I'm very excited to be here. I am confident that everyone has a lot to add to this conversation. So what I thought is that Dr. Poonam, Simin, and I would, talk for a little bit, and then we would open up the conversation. I'm sure everyone has a lot of insights and a lot of learnings. Just very briefly on my background, and I've realized that most of us who are looking into longevity or women's health or healthcare most often have either a challenge that we have faced or an opportunity that we have seen, even personally, that we connected with, and we thought, you know what, I see an opportunity or a problem I want to solve, and let me get out there and do something about it. So my journey is I was at Goldman Sachs for a long time, and then I worked at a very large family office that had actually been investigating longevity for about 20 years, even before people talked about longevity, and that's about 9 years ago. And that's when the first spark of the potential for us to make our lifestyle changes and have, an impact in our health today was, planted a seed inside of me. I started inquiring more, but to be honest, I only realized the potential about 2 years ago when I went through a personal journey of wellness after basically being burned out. And I experimented with fasting. I restored my gut health. I changed my strength training program, and I actually had been feeling a lot of joint pains for about 20 years, and that was gone. And I thought, oh my God, this is crazy. And I started to do a very deep investigation and started to work with a lot of doctors, including the two incredible women you're going to meet today. I visited a bunch of longevity labs. I spoke to several scientists, and I just started to learn and read and talk. And I decided then to start my own investment company. It's called Human Forward. So I'm advising and investing in different startups in the space. I work with a lot of founders, and we can talk later about the innovations I'm very excited about. But I think I've seen many people going through autoimmune diseases or being borderline diabetic or having a chronic disease, and just realizing that science has matured to a point that we can, sort of be focused on being healthy and not getting sick. So anyway, Simin and Poonam are two collaborators I've been working very closely with. We are very excited to be here together. So why don't we start? Simin, do you want to introduce yourself? And then Poonam, do you want to go ahead and introduce yourself?
Hi, everybody. So nice to meet you, and thanks for having us here today. My name is Simin Lee. I am an alum of the MD MBA program, graduated in 2016, and am a cardiologist at the Brigham and Women's Hospital, as well as a current member of the HBSWA Fellowship in Life Sciences Entrepreneurship, trying to build a group telehealth company for women's heart health. So, like Ana, so we, such kindred spirits, and I'm sure we have so much in common with many of you here today. I also, had my own journey towards this area of shared interest. And for me, it really started at that inflection point between school and being in training, in clinical training. I found my way to cardiology. I just fell in love with it and, was so excited to start, but timing is everything. And a number of things coalesced to make it a very sort of challenging and also perspective shifting time. I became a mother, the pandemic hit. Sorry? Okay. Yeah, I became a mother. And then just a few months later, the pandemic shutdown happened, cutting us off from family, while I was in the COVID ICUs day in and day out. And, then eventually seeing my own patients come back very metabolically and cardiovascularly unwell after having been cooped up, gaining tons of weight and really not even looking like their former self. So it caused me to do a number of things. I mean, number one, I decided that I would, take a step back and move towards a physician entrepreneur pathway in pursuit of broader impact in this area, the intersection of sort of metabolic health and cardiovascular health, which, is very much overlapping with the interests of those in longevity science. And then the other thing was that I would try to become well myself. So, I had been an athlete in college, I rode in college, but obviously there's less time for that in residency, but there's always, not enough time. So I just decided I was going to go back to movement. And for me, that was marathoning. So, we have so much sort of, that's shared in common here. And it's great to see so much interest from this Women's Association and the conversation today. So thank you again for having me and looking forward to chatting.
Thank you, Dr. Lee. That was a great intro. Thank you for having me. I'm Dr. Poonam Desai. I actually was kind of thrown into longevity medicine. I started as an ER doctor. I was working in New York City, and I was also a professional dancer. So fitness, nutrition was kind of part of my DNA. As an ER doctor in Queens in New York City, I was starting to see people who were getting, the strokes and the heart attacks. They were at their end stage, or cancers, young people with cancers. And I started asking myself when I was there, is there something more I could be doing to, help these patients? Like, what if they just knew X, Y, and Z about their genetics 20 years ago? Could they have done something differently? At that point, I went back and I did multiple fellowships. And I learned longevity medicine. And was kind of thrown into longevity medicine. So I studied genetics for a while, and here I am as a longevity expert and physician, really working in, California and New York with patients to help with health optimization and prolonging health span.
Very good. So, Poonam, why don't we start with you? I mean, I should say Dr. Poonam. I think in the last decade, for those of us who have been following, and I guess there's a lot of new books and a lot of more talk about it out there, but we're witnessing the birth and growth of this new field of medicine, which is the longevity medicine, right? There are several studies and new science that have actually matured, that have started about 20, 25 years ago, and now there's more evidence on the potential of longevity medicine. But there's still widespread misinformation and even resistance towards health span, longevity, and lifestyle medicine. So why don't we start with you, Dr. Poonam? Just what is your, a broad overview of what longevity medicine is, what is personalized medicine, which is what you practice. And, there's a lot of talk about precision medicine. I'm a huge fan of precision medicine. That's what I've been following. But why don't we go just deeper on what exactly it is, what is the evidence, and how is it different from traditional medicine? So we can, together think, okay, so what is the future of medicine as a result of all the disruptions that have been happening?
Yeah, no, all great questions. And, all three of those terms are kind of intertwined together. So, I'll start with personalized and precision medicine. And what it does do is it focuses on prevention and early intervention. And what we're doing is we're trying to utilize genomics, lifestyle preferences, environmental factors to create a personalized plan for the patient. No two people are exactly alike, not, their DNA is not alike, the way they grew up is not alike. And so one size fits all medicine, traditional medicine, as we see in 2024, is not working. So with longevity medicine, with precision medicine and personalized medicine, the goal is to extend health span. We don't want to just live to be 90. We want to live with vitality until we're 90. And how do we make changes? How do we work with a physician utilizing advanced technology and all that we're learning through genomics to help an individual optimize their health? And so I think that's a very simple definition of what personalized longevity and precision medicine is.
Very good. Thank you. When Jagrudi and I were discussing the idea for this panel, one of the topics I've been, investigating is all this
learning
new
so
science.
much everywhere. I'm learning so much.
Oh, I think, Judy, would you mind muting your Zoom? I think, thank you. A lot of the new science, which I think is wonderful for us to, have a paradigm shift in what is possible in terms of being healthy, is not geared towards women, right? And there's still a lot of lack of knowledge on what women's health really means. So one of the work that I've been doing with Simin is really going deeper on women's health, right? I'm particularly concerned that a lot of the innovation doesn't take women's metabolic health and women's conditions into account. And I'm concerned that the gap in health will only increase with the new science not being geared towards women. There was a study published this week, which I can share with anyone who wants later, that McKinsey did in conjunction with the World Economic Forum, that estimates that about $1 trillion could be added into economic productivity by supporting the 4 billion women in the planet living healthier, which is just crazy. I think, Simin, in your view, how do these recent breakthroughs in technology and science in the longevity space uniquely impact women, and what are the implications for our health span and our lifespan? So how basically, personalized and precision medicine can help shape the future of women's healthcare, which is, a big part of the work you've been doing and that you're trying to scale up as a solution to women everywhere.
Thanks, Ana. These are great questions, and the questions of the moment. I mean, I think that number, that sort of statistic you cited is really staggering and very believable. I think it's helpful when addressing your questions to just start from start from a little bit of like, where do we stand? Does women's longevity, women's health span stand today? And the good news is that we're kind of starting with an advantage. So women already live longer. We outlive men on average. And, you know, everyone's lifespans are increasing globally, but women's rate of increase in their lifespan is outpacing that of men. And this is kind of impressive because it's despite the fact that maternal mortality remains an unaddressed issue globally and is strikingly high even in developed countries like the United States. And, you know, I think drilling down on that a little bit more, childbirth is such a sort of defining part about what so many people think of when they think of women's health, pregnancy too. And yet those sort of, you know, biological phases are a real setup for what at the end of the day is the number one threat to women's lifespans and health spans, which is honestly, you know, my bread and butter, cardiovascular and cardiometabolic disease, the boring, common, prevalent stuff. So, you know, I think it's really helpful that there is, you know, new interest in the concept of longevity and that there's a conversation that is gaining momentum. But I think that, you know, when you ask about challenges and opportunities, I think that certainly with the advance of technology, genomics, you know, and precision medicine that we've talked about, there are a lot of opportunities, of course, to make a dent in cancers that specifically affect women, screening for them, targeting molecular therapy to more specifically treat those cancers, for example, or using polygenic risk scores to try to better get a sense of the kind of cardiovascular disease that women in particular may be at risk for. But I think some of the challenges that I worry about are that we get caught up in, you know, like sort of interest in the cutting edge, which is important, while maybe forgetting about some of the bigger picture things that we've known for a while, which is that women are at the number one cause of death in women is heart disease, you know, and then stroke is closely behind that. And we know that it's undertreated, underdiagnosed. So, you know, when I think of some of the most exciting advances, it's honestly in getting towards trying to address those cardiovascular risk factors or the cardiovascular diseases themselves. So anything that can help get women moving and exercising, you know, is honestly probably one of the highest yield, biggest bang for your buck innovations and ways to sort of help keep women healthier for longer. We know that to be true. But then for some of the other things, I mean, hypertension, right? Over 52% of people who die from blood pressure related causes are women. 1 in 2 adults has hypertension. It's very hard to get a sense of whether someone does, but there are new wearables coming out. One is already commercially available in Europe, manufactured by a company called Actia, that's basically a wrist-worn, cuffless blood pressure monitor, continuously measuring your blood pressure at the wrist throughout the day based on photoplasmography. So that's really exciting to me. Telehealth has become our you know, part of our new normal, and it's kind of like unexciting in that way. However, we know that 8 in 10 women delay care, you know, because of family responsibilities oftentimes, and that means that they're sicker when they ultimately do seek care. So having telehealth, you know, in part because of the pandemic, become part of the normal healthcare fabric is very exciting for women's health and women's longevity, because it means that it's going to be more convenient for women to touch base with providers. Contraception, you know, helping delay pregnancy to a time when women are able to economically manage a family, start a family, and then, you know, go back to work. That's important, and there's lots of innovations medically, technologically there. And then GLP-1s, you know, Ozempic, Zepbound, Mounjaro, these medications have been real game changers. They're not only treating weight loss, you know, and there are more women than men with severe obesity, but also preventing cardiovascular disease, renal disease, and diabetes as well. So there's a lot of exciting things that are happening. I think that for me as a cardiologist and a cardiometabolic expert, you know, I'm most excited about the things that are addressing these big, you know, boring problems that at the end of the day are still the number one threat to women's health.
This is so exciting. I think I would love to just go a little deeper on some of the innovation and how that is affecting our lives on the day-to-day, because there's a lot of buzzwords out there, right? And I know, Poonam, on your day-to-day, you have worked with a lot of these new innovative treatments and tests and, you know, supplements and diets. And I would love to, you know, to talk a little bit more about that. I have been personally experimenting with, you know, a lot of things. I'm not taking personally any of the, you know, some of the drugs that people take for health and longevity, because I'm not very keen on taking those, but I have been experimenting with different at-home tests from gut health solutions, different treatments, some of which Dr. Poonam offers in her longevity clinic, and just I think just going a level deeper on understanding what all of the metrics mean, right? I, to be super candid, hadn't really observed anything related to my own personal annual, you know, exams until about 2 or 3 years ago. And I was like, you know what? Let me actually understand what's, you know, all of these biomarkers and how do I actually track progress. So I would love to get a little deeper on, from all the buzzwords and everything that's been coming out, how have you filtered, you know, solutions that could actually help women and all of us be healthier today, you know, for a better tomorrow?
All great questions. I'm kind of going to go off what Dr. Lee said because she addressed so many great points in it. I think we have so much access to technology and biomarkers, and our job as physicians, as longevity experts, is really sifting through it and seeing which one is evidence-based and which one is going to move the needle the most. And more importantly, you know, we're finally taking patient preference into account. You know, having a conversation with the patient and been like, are you going to benefit from the tracker, or is it going to lead to an anxiety? Because you see two groups of people who want to track, people who don't want to track. And we really get to know the patient. And I think what recently in modern medicine, what we've started incorporating is motivational, you know, questions, and really incorporating lifestyle changes, almost therapy. You should be able to go to your doctor and they should be able to speak to you in a language where you want to make changes, not a quick 15-minute appointment. And I think in our practice, you know, in most longevity physicians, precision medicines, we start there. We spend a lot of time getting to know the patient and then coming up with a plan that's very personalized to them. There are people who, if I tell them to wear the Oura ring, won't wear the Oura ring, so we got to move to the Whoop, or, you know, and then continuously looking for ways of where we can use the most advanced technology. And the most important thing, which social media has made slightly easier, but there's a lot of misconception, is empowering the woman with knowledge, right? I want to make you the CEO of your health. Once you start understanding your biomarkers, what they mean, you're just going to be much more motivated to make those changes. And what advancements and technologies have given us is the ability for people at home to see how their decisions are impacting their health, whether it's the Dexcom that, you know, we have people that are not diabetic wearing to see how their diet is affecting their glucose surges. You have the Lumen, which you can see, are you in ketosis? Are you not? How is your diet affecting your health? You know, and the trackers from sleep tracking. As we know, sleep is the foundation of health. People will say movement. Movement is the foundation of health. But no matter how much you move, if you're not well rested, that movement may not go very far. And so it really is about empowering the patient to understand their genetics. What are the risks that you are born with? And just because you're genetically born with something doesn't mean it's going to express it. Our job is to really understand epigenetics and try to make lifestyle modifications where little things like sleep, diet, nutrition, you know, supplementing, and I say supplementing in quotes because we shouldn't rely on supplements as our foundation, but supplementing, you know, supplement a foundation, you know, relying on all of that to help create change. And I think the biggest change we've seen, and people are finally talking about it, is hormones, right? We were kind of left out of the conversation. We have Viagra for men, that was big, but what about women? And it's been a man's world, especially when it comes to research. And I think in longevity medicine, hormones is a huge aspect of what we do. We can't ignore hormones. You know, estrogen, there are some people will say have 400 functions in our body. And so we want to make sure that as women fluctuate, whether it's your first menstruation, multiple pregnancies or hormones change again, and then menopause, that we're really creating personalized plans and helping the patient become more aware of these changes and asking for help. You don't need to suffer. We have answers, and we want to use that technology to bring about answers.
Thank you. And I've been using Enrollment, and it's been life-changing for me in terms of learning about my metabolic health and when my body is burning fat or using carbs, and just feeling, healthier overall. And it tracks a lot of movement too, so I highly recommend it. You ended up talking about challenges, and I think that's where I would love to go next. I actually only learned about a year ago two facts that honestly kept me up at night. One is, and actually three facts. One is that only 40% of doctors are trained in menopause related training. Two is that a lot of women actually die in the hospital from cardiovascular related issues because doctors are not trained to know that the symptoms showed by women are different from the symptoms showed by men, which includes having sort of a burn in your stomach, which some people think it's resulting from bad digestion or something, but the woman is having a heart attack. And the third is that until 1993, a lot of the clinical trials were actually not conducted in women, including drugs that are only women-centric, right? And what I've seen is that there's very limited funding towards women's health, which again is not just sicknesses that pertain only to women, but includes sicknesses that affect women differently or disproportionately, right? Including autoimmune diseases, migraine, osteoporosis, cardiovascular diseases. So, Simin, you're part of a big, research institution. You've been, obviously a medical practitioner, and now you're a founder too. How have you encountered these challenges, and what are some of the ways we can hopefully overcome, the limited funding in research, expanding clinical trials, and honestly, having more funding for startups like yours that will be, hopefully solving, the problems that women face today?
Yeah, this is top of mind for so many of us. So I'm really glad that you talked about both research and innovation, because the sort of representation of women, whether it's like research subject, user, or investigator, entrepreneur, is obviously not where it needs to be, and we have to come up with better strategies for that. So, what is the actual situation? I mean, I think we all probably have a gut sense, right, that women are underrepresented. But just to sort of put some numbers to it, and we talk about this in cardiology, which is a very research-oriented, evidence-based field. With we're blessed to have lots of evidence, lots of clinical trials to support our decision making. We know and discuss often about the underrepresentation of women in our clinical trials. So about half of people with cardiovascular disease are, as you would expect, women. And yet, when you look at sort of all of the research subjects in most of the clinical trials that have been done to date in cardiology, around 40% are women. And the same is true actually in cancer, which is right behind cardiovascular disease for causes of death, top causes of death for women. So that's an issue, just because you can imagine, as new medications, new therapies, new procedures come down the pipeline, you want to be able, as the doctor, as the patient, as the family member of the patient, to understand, well, okay, this is what you saw on average, but what happened when you just looked at women? Or what was the impact in women? Were there more side effects in women? Everyone's talking about GLP-1s right now, but just as like a very relevant, salient example, women on GLP-1s tend to lose almost double the weight as men, but they're also 2 times as likely to have side effects. It's one of the rare examples where women were more represented in the clinical trials looking at GLP-1s than men. But, those are important things to know. And yet that, with the exception of GLP-1s, we really don't have that wealth of data about how women are responding to the, cutting edge treatments in cardiology and oncology. So, I think, how do we address this? There's lots of thoughts. I mean, and they all have to do with some of the reasons why women might be underrepresented. So I think, you know, a lot of this comes from institutional fear of intervening on women of childbearing age and potentially causing, you know, teratogenic, like harm to a fetus, or interfering with a pregnancy, causing pregnancy related complications. So there's that concern. I think there's also pragmatic concerns, you know, much like the delaying of care we talked about earlier. Women, you know, for better or for worse, often have or bear the greater burden of family responsibilities, home responsibilities, and it's harder for them to come in for a visit for a clinical trial or to engage in all of the procedures that are required in a clinical trial. And, you know, now that we are in this new COVID normal, some of the excitement I hear among my clinical trialist friends is around, you know, increasingly turning towards all remote, completely remote trials, trying to be more pragmatic, trying to make it more equitable, more accessible for anyone, be they a man or a woman, to participate in clinical research. So I think that's important. I think that the other thing, honestly, is like intertwined with what you were getting at before, Ana, like having more representation of women, you know, in the seats of people who are running the clinical trials, you know. And I think that once we have more investigators who are women who might be attuned to these issues, be they very sort of women specific, you know, peripartum cardiomyopathy, a pregnancy related cardiomyopathy, or just heart attacks in women, you know, having more female investigators will help improve representation of women in research more broadly. When it comes to innovation, entrepreneurship, and much of the work that so many of us here are engaged in, there's similar parallels. I think one thing that I keep sort of thinking about, and happens both in research and in the startup world, is a little bit of a paradox. Like, so much of the funding, the funding dollars, the investing dollars that are going into solutions for women, you know, do seem to be anchored in pregnancy, you know, solutions to help women get pregnant, or something about pregnancy. And obviously pregnancy is a very big, you know, life-changing medical experience that only women can go through. But as we were saying before, pregnancy is sort of, you know, it's just one part of a woman's life, which we know is already longer than men's. And, you know, there's a lot of things that happen in pregnancy, or can happen in pregnancy, that set women up or get them started on a road towards what ultimately is the cause of death in the end: cardiovascular disease or cardiometabolic diseases like diabetes. And so, you know, I think that there's a little bit of we're trying so hard to fund solutions that help women become mothers. But it would be great to see more attention devoted to all of the years after motherhood, and trying to help women stay healthy, not only during pregnancy and getting pregnant, but in all the years that come after, so that they can live longer, live healthier, more healthily for longer. And I think that part of that is going to be learning that happens, you know, in parallel with this renewed interest in longevity, on the investor side, on the founder side. But part of it, I think, is also going to be just seeing what solutions actually resonate with patients. You know, I think patients actually know this in their bones. And I think that, you know, we are sort of having a harder, you know, there's going to be there's a more conservative feeling in the air, right, with investing and getting companies off the ground. So I think that good old product market fit, finding something that actually delivers value to patients who are thinking about this in the long term, is going to drive things in this direction ultimately.
Thank you. Thank you. This is great. Actually, this leads. I want to make sure we leave enough time for all of us to chat. I would love for us to brainstorm together. So, given this scenario and all the challenges, what are the opportunities for us as, let's say, consumers of these new solutions, but also, you know, executives, investors, entrepreneurs? And I think, you know, I would imagine a lot of the people on this roundtable have probably questions, but also insights on some of these opportunities. So maybe Dr. Poonam, do you want to lead a little bit with how you're seeing, you know, these innovations leading to new entrepreneurial opportunities. And then maybe Simin, you can talk a little more, and then we can maybe open up, for conversation, so we can have a brainstorming all together.
Yeah, one place that we're seeing a lot of innovation with is perimenopause and menopause. I mean, we're finally bringing that conversation to the table, and we're seeing proper research being done. I mean, we had based all of our hormone replacement therapy on one very, very flawed study. And now we're getting scientists, researchers to do more research. We're bringing awareness to the table. And now we're seeing a lot of innovations. We are using stem cells, we're using exosomes, we're using bioidentical hormones to address the hormone deficiencies that happen during peri and menopause. And not to forget to mention postpartum. We've actually completely forgotten about postpartum. And if you happen to be in medicine, you'll know nobody owns postpartum. You can't go to your gynecologist and see a gynecologist postpartum. Your regular doctor was like, I don't know much about postpartum. The pediatrician's like, that's not my world. We've actually forgotten an entire, group of people that are dealing with a huge significant change. And we're starting to see a lot of money going into research and funding of what can be done to help it, whether it's bringing awareness, whether it's mental health, utilizing telemedicine, and then utilizing, like I said, exosomes are becoming big, stem cells are becoming big to really help address some of the deficiencies that we have in this realm.
Thank you. Simin, do you want to add your perspective? I mean, you're in the forefront of using a technology solution to scale delivery of better healthcare to women more broadly, focused on exercise as a tool for better health and longevity. So what else do you think, can we use to scale innovation?
Yeah, I mean, I think so. I've been thinking a lot lately about. Oh, I'm sorry, I'm hearing myself echo. I've been thinking a lot lately about, certainly all of those issues, sort of those opportunity areas that Dr. Desai just raised. But, I think for women in particular, we know that women make 80% or more of the healthcare decisions in a given household. And I think, one thing that we have seen is that women are communicators, and a lot of the intervisit care, the messaging, the back and forth with providers is being driven by women, whether it's for their kids at the pediatrician, for their husband. In COVID, a lot of people learned how to communicate with their doctors, with their providers. Now, on our side, it's been overwhelming. And I think it's sort of, a reason that some doctors are burning out. It's hard to handle the volume. But I think, you had mentioned this concept of entrepreneurs, where are they innovating? How can they sort of, align themselves with existing sort of incumbent healthcare entities? This is something I've been thinking about a lot. Like, if there is a way, I think there's a big need in women's health and everything it touches for solutions to help get into that intervisit milieu, and to help facilitate communication, to answer the questions, to help coach the patients, to help them navigate an increasingly fragmented and complex healthcare landscape. This is what patients need a lot of help with, but what the existing healthcare infrastructure does not have the capacity to help them with. I mean, I give out my cell phone number to all of my patients so that they can directly reach me. But I know that that's not the norm. And I know that there are so many folks out there who are they're running into side effects that maybe require urgent medical attention. They can't get in touch with someone, or they have questions, their medications out of supply, or maybe there's an interaction with some of their other medical issues. And it's just so hard to get in touch. So that's one area where I feel like there's a big need in women's health and a big opportunity. The other thing that I've been thinking about a lot lately is community. I mean, so much of what women's, health comes down to at the end of the day is community, whether it's you as the caretaker in your little micro community at home, or whether it's you as the patient trying to figure out if what you're feeling is normal, or which doctor to go to, or how to deal with some basic side effects. And I think that, there's a lot of different ways to harness technology to promote community building and community formation among women for the purpose of women's health. Knitting it together is something that I've been wondering about, whether it's as simple as SMS and texting, or, much more sort of, fancier scalable platforms, whether AI is involved, I don't know. But I think community and communication are big opportunities in women's health to help drive innovation forward and improve outcomes for women.
I think that's such a great point. I was part of a women's health panel last week, and I realized that there's more than 300 symptoms that women can go through in perimenopause and menopause. I mean, I'm not a doctor, but I was in shock, and apparently there's not an official list. So there was this woman who's had a shoulder pain for 10 years and she didn't know it was menopause related. Depression is often a symptom, but doctors are not connecting the dots. And I think a lot of this we learn through community and through exchanging learnings and questions and ideas. So I do think there's a huge opportunity for more community. I also do think that there's a huge opportunity to disrupt everything we consume, right? I think I'm at the point now, okay, why do I sleep and how do I maximize my sleep? Why do I eat and how do I maximize my food as medicine? I'm also huge in exercising, but how can I exercise to maximize my health, and how can we all do that, right? I think Jagrudi put a question on the chat that I think would be great for us to cover, which is how should women think about their health in different life stages, right? She's asking about women above 75 years old, but I now realize with all the different hormone phases we go through, maybe the solutions cater to women before pregnancy, during pregnancy, post-pregnancy, perimenopause, menopause, post-menopause, post-75. These are very granular phases. So why don't we start with the question that maybe we open up the conversation so everyone can get a chance? Either one of you wants to take a crack.
The question about older women, health considerations in women over 75. This is a great question. I mean, so, in cardiology, you think of it as a specialty with a lot of older individuals, but it runs the gamut. What I would say is that, again, like with heart disease still being the #1 killer of women, I think anything that can turn down the dial, right, on heart disease and heart disease risk is critical to think of in older women. There is a sort of paradox here in that the older someone gets, the more likely it is for the medical establishment to treat them as old and to want to sort of withhold treatment, to not over intervene. And we understand where that's coming from. And of course, you don't want to throw too many medications at someone and cause, a bucket of interactions and suddenly they're falling, for example. But, the older someone gets, the more likely it is actually, if they've lived that far, that they're going to keep living, that they're going to live longer. And so if anything, we should be more attentive to controlling the blood pressure, to lowering the cholesterol, to eating well and controlling blood sugar, to getting exercise. I think exercise is probably one of the biggest things that can make a difference in older age, where functional status, the ability to tend to the basics, to, get dressed on your own, to, clean yourself on your own, go to the store on your own, get in and out of the car on your own, all that independence is really affected by exercise. And it's not, marathoning, but rather just, walking at a conversational pace and doing some very simple strength exercises. This helps, address frailty, risk of falling, bone fractures, and maintenance of independence, which is such a key part of happiness and health span for women. So I think, in my opinion, anything that can keep heart disease at bay and anything that can, boost strength and endurance in women, even though we're a society that all too readily accepts aging, slowing down because of getting older, will help people, women in particular, enjoy their lives for longer. So, those are my things that I'm thinking about when I see a patient in her 70s.
I think those are all great points, Dr. Lee. And, when you think of somebody 75 and older, yes, exercise is very important, but a lot of people complain, well, I just don't have energy. I mean, how do I, exercise? I can't lift a 5-pound weight. And that's where we really come in and say, okay, let's talk about nutrition. As we get older, where our bodies are not as adapted to extracting nutrients from food. So again, education, working with your physician to be like, what should I be eating? Because as you age, and if you have grandparents or parents, they just eat less. They're not eating as much as they used to eat when they're 25, 35 years old. So really going in and not, a lot of times when you go, the problem with our American healthcare system is that it is so diverse in the sense that it's so scattered. You want to go to a rheumatologist, they're not going to talk about nutrition. You go to a regular doctor, they're not going to talk about, your joint pain. So really putting it together, and that's where precision medicine and modern medicine comes in, is to say at 75, what is going on holistically? What do we need to address? And that is nutrition. Are you getting enough protein so you can build the muscle, so you can keep moving? And are you moving in the right way? We don't want you to be running for an hour when you're 75, but we do want you to run a little bit and make sure you're building muscle, which again requires hormones. And so, really putting everything together instead of having to see the scattered care and nobody really looks at the big picture. We know we should look at the big picture. We just don't have that type of structure in our healthcare system where we can put all the pieces together and one person can let you know what the plan is.
I mean, I could literally spend the whole day talking about all of this. I've been so obsessed. And by the way, I think the three of us are available after 1 p.m., but I want to make sure everyone has a chance to ask questions. I've seen some questions on the chat, but at this point, whoever wants to contribute, ask a question, give a point of view, I mean, we would love to hear.
Can I make a point? Is that possible?
Of course. Hi, Meredith.
Hi, first of all, so inspiring and interesting to hear these brilliant perspectives. And I know speak for many of us, we are all very much aligned, kindred spirits, those that are participating and speaking. So thank you for this. A few observations. So I'm the founder and CEO of a platform. It's a community for women 60 and better, and we keep them at their best. And we do that through movement, predominantly in fitness, wellness, and enrichment programming. So one of the questions that I have is, we all know scientifically and through the evidence that movement is key, eating better is key, all of that. Yet the majority of Americans, I will say that I'm sure some people here know the actual data, are not motivated or inspired or directed or supported to get into a program like the ones that are available, like ours and others that people on this call have. So my question is there any research, because getting the fit fitter, the well better is obviously an opportunity in a market in and of itself, but the majority of people aren't engaging, even when insurance companies are providing these types of services for free. So I'm just curious if there's any work that you have been part of in terms of behavioral modification, rather than taking a simple pill, which we know isn't the answer. So I'm just curious if anybody's doing any research or knows anything about behavioral modification in the majority of the population.
That's a great point. A lot of us know what the right thing to do is, but we're just not seeing a lot of people doing it. And one important aspect that we, even as Americans, don't have as much as if you looked at the blue zones, and if anybody watched a documentary,
Yep.
Is community. A sense of community is what brings the biggest behavioral change. And we've seen it through history. We're seeing it right now. And I think there is a lot of research going on, is how do we bring communities together? There are lots of groups, investments going in to say, we need to start creating communities where everybody is wanting to move, because just being alone in the past, even if your partner doesn't want to move, it's really hard to get to the gym if your partner is somebody who doesn't want to go to the gym. So really, community is a key word. And I think Dr. Lee brought it up earlier. It's really, what we're seeing, my background is lifestyle medicine. What we're seeing is that once the community is engaging in it, and there are sports like tennis, golf, that are sports that as you age, we've noticed more longevity in people who are in those sports. And again, it comes back to going somewhere to socialize, working out, being out in the sun, really using all of that to help bring about some of the changes in people. And then time is the other one. We are a culture that is working so much. Like, I have to tell my patients, take exercise snacks. You need to take a snack to take, work out, go do 5 minutes of lunch, come back to your desk. But our culture is sit at a desk for 9 hours.
I
Thank you
think,
so much. There's so much more to discuss. Thank you.
I'll just jump on really quick. I mean, I completely agree with everything Dr. Desai mentioned, and I'm excited to learn more about women's vest. That sounds fantastic. I think, part of the issue, I think there's a number of issues, but one of them is, I think everyone knows it's good for you, but we physicians don't do a good enough job of explaining or sharing how good it is for you, like exactly how good. So I mean, if you had a heart attack once and you walk 30 minutes a day, you are cutting your risk of having another heart attack in half and your risk of dying by 25%. Those are numbers that are extremely powerful. And honestly, like the only thing that even comes close in 2024 to those numbers for heart attack survivors is aspirin. So when people hear it that way, that can make a difference. I think being specific about what exactly are the benefits is one thing. The other thing is like, what does it actually take? Not enough people, a lot of people think, oh, exercise and eating well is like going to require you that, you to turn your life upside down and pay tons of money. That's not true. I try to make a point of explaining it can take, nothing more than a brisk walk. And if it's 20, 30 minutes a day, like let's talk about your life, your work, your family obligations. Let's talk about where this would fit in. Can you take a meeting while you're walking? Can you go on a walk, instead of sitting down to TV after dinner with your husband? I think just being really, the more specific you can be, the more motivational it can be. And then, I think the last thing I'll just say is recognizing that for 70% of the people in this country, overweight, excess weight is a problem, and that can really, that I think there was something in the chat about the interaction between mental health and metabolic health. Like, when weight is something that people feel they don't have control over and that it's a problem for them, it's very depressing on the mood and the motivation. And so my observation in my own practice has been when I do treat women, with medication assisted weight loss with medications like Ozempic, there's often an internal transformation that occurs with the external. And, once they're feeling, like the weight loss is happening, they're feeling better about themselves, they start to turn to lifestyle modification in a way that they haven't before because they're excited and they're feeling good about themselves. So, recognizing when medicine might have a role, and, recognizing that it can actually catalyze the non-medical, work and transformation, that can be really important and life-changing for people.
That's amazing. And I'll just close by saying, like, having been a caregiver to a very sick parent who had many specialists, it was absolutely brilliant what you said to have like a quarterback, because there's so many silos of medicine. But quite frankly, even going to cardiology, nephrology, and pulmonology, and every other specialist, nobody mentioned improving what you eat to improve your health. So we have so much work to do. So thank you for sharing that. But the medical community needs to be inspired to help those that want to be helped. So thank you so much for the work you do.
Thank you. Who else has, oh, go ahead. I see.
Gitu.
Hi, Gitu.
Hi, how are you? Thank you for sharing, everybody. This has been amazing. I actually missed the first 20 minutes, so someone may have already brought this up, but I just wanted to say that I think it is pretty amazing how, like, in this country with medicine, people think that they are the target audience for anything that you guys have been talking about, whether it's a community or whether it's nutritional programs or wellness programs, once they get sick. And I think that there is a much bigger target market for all of the things you've been talking about today. And I just don't think it's been positioned in the market. I think what's the biggest noise in the market is things like Ozempic and, the magic pill and everything, but not necessarily any targeted marketing to people earlier in their lives, in their 40s, or maybe even children who learn nothing about nutrition all through school. So I really do think that there's a huge opportunity to educate across all age cohorts.
100%. Yes. To me, that's the biggest hurdle we need to overcome because, you know, you're not getting their information from your doctors. And I think the integrated approach is where, you know, hopefully we're leaning towards. But I agree 100%. I know Felicia also wanted to say something. I want to give Felicia a chance.
Yeah, my comment actually piggybacks right off of Gitu's because I work on the consumer diagnostics side of things, and I see a lot of businesses out there that are trying to solve the self-diagnostic, self-testing, you know, at-home testing space. But then my question is, you know, do consumers really know what they should be testing for? And to me, that's the biggest problem is, you know, the self-diagnosis to even know what type of testing, you know, to even start with to get to that precision medicine. So I was curious what our experts here think about that and how we can solve that piece.
Can I add one point to your question? Because it's related and it's something I've been thinking a lot about, which is what are we aiming towards, right? What's our goal? Because I think some of the issues we all have is that maybe the metrics and the goals we've had for the last, you know, decades are wrong. So I think the paradigm shift is not only what we're measuring for now, but what are we working towards, right? How do you actually assess good health today and good health in the future, and how do you, you know, work towards that? But I agree with your point that are people aware what they would be testing for, but in addition, how is that going to impact what they're aiming for?
I think those are both great questions. There's not one test that could kind of push you into precision medicine. It's really having the discussion with a precision medicine physician and figuring out what labs work for you. And Anna's 100% right. We actually don't look at what the reference range of normal and abnormal is that, you know, the labs told us, or even what our medical books told us. Like, I don't want your hemoglobin A1C to be 5.5. That is not normal. In about 2 points, you're going to be pre-diabetic. And a lot of people have been told by their doctors, that's fine, you know, you're okay. But they were never told, hey, you're hovering on, you know, metabolic disease. So we gotta, you know, you already have it. It's happening right now. We gotta really nip this in the bud. And I think finding a physician, a practitioner, and I'm hoping that med schools start going towards this trend of really working on health optimization, not just barely making it or not just worrying when you get to the disease.
Simin, do you want to add anything, or should we see if anyone else has any questions or points they want to make?
I'll just briefly add. I mean, I think that you know, it is there's sort of two sides to this, like consumerization and democratization of testing, of treatment, even. You know, there's the healthcare sort of provider workforce is very limited. It's not adequate to address pretty much any problem out there for the number of people who need their help. So obviously these kinds of solutions make sense in that way. But, you know, I think it's a fine line to walk, and whatever we can do to either expand or creatively reallocate the workforce. So, I mean, for example, you know, a lot of these telehealth companies, they have like NPs and PAs and stuff like that. And, you know, that's great. They're not doctors, but they're still pretty expensive. There's, you know, pharmacists are probably an undertapped type of provider that in 48 of 50 states can prescribe and can counsel in collaboration under the supervision of a physician. And, you know, at a program that my hospital ran, the remote cardiovascular health program, we actually had teams of doctors, pharmacists, and then navigators who are college grads, you know, aspiring to careers in healthcare, who are trained on a clinical algorithm to help, you know, manage hypertension, manage high cholesterol, all remotely by the phone, just implementing an algorithm. And when someone was complicated, you know, it got escalated. But I think that sort of starting to think like, well, how can we get more people involved, more hands on deck to help, will free up some of the capacity of the folks who can help patients, you know, like figure out, okay, I tested positive for X, now what? Or, you know, I might have this this gene mutation. What do I do next? What are the next steps? You know, those kinds of conversations just aren't frequent enough right now for the sort of pace of innovation that's happening in self-testing and self-treatment.
Can I just ask a question related to that? I'm a big believer in, I think it's the Cleveland Clinic that has the model of a team of specialists that deal with patients. Why isn't that more prevalent? I mean, you know, innovation is making, I know in oncology, you don't just have an oncology specialist, you have a subspecialist and even a subspecialist, right? And so, you know, structurally, how do we get at that? Or as consumers, how can we replicate that in a way that works for us?
So I think team-based, you know, having teams, you know, multidisciplinary as in, you know, cardiology, endocrinology, primary care, and interdisciplinary, social work, doctor, nurse, weigh in and help guide patients is so critical. But you're right, it's not the norm. It probably should be the norm. The reason it's not is, you know, it all comes down to money, reimbursement, payment. You know, until insurers are kind of demanding this, I think it'll be hard to really drive it forward. But the other sort of big force in medicine and healthcare, besides reimbursement and the insurer, is the patient, you know, and what the patient is asking for. And so, you know, they definitely my more sophisticated, educated patients, but every now and then I have a patient who gets their doctors all on an email or on an you know, a secure messaging thread together and just says, these are my concerns. Can you help me sort through them? Can you all weigh in? And of course, there are physicians who start those conversations. There are nurses who start those conversations. But I think, you know, the more that we can do that, the more that we can do that, the better it'll be for patient care. And particularly, I think, for women who, as we said again, are really driving a lot of communication, a lot of healthcare decision making.
Thank you.
I think, Jagriti, the main rate limiting step is time and money, you know, to get all the doctors together and to have a conversation. Like I can't even imagine if I'm in my ER setting to get 5 doctors together and have a conversation about a patient, or even to find the time because they're so back to back with our insurance models and our healthcare model. So really changing the model where we do have, you know, exactly what Dr. Lee said, that type of care. There are concierge practices who are doing exactly that. Like you can go and pay a premium price and get all that, but it comes at a cost.
You know, I think there's a business opportunity here, and and not related to reimbursement, but maybe there's a business model where just the communication aspect, collective communication aspect can be done on a private basis. So the healthcare is done on the insurance basis, and maybe we take this little aspect and do it separately. Anyway, if anyone's interested in talking more about it, I'd love to do so. Cecile, I'll see you soon. There's a bunch of topics we'll talk about.
And I think both Dr. Poonam and Dr. Lee were very humble. So just so you guys know, the way they are disrupting what we've been talking about, which is, you know, part of the reason that I've been trying to collaborate with them, is Dr. Poonam has been working in longevity for a while, and she does mainly 2 things now. But she has a concierge service that treats patients, and for full disclosure, she's been treating my husband. You know, she was here for a business meeting with me, and I told my husband to just listen in, and he, you know, all of a sudden got his HbA1c level, which basically measures glucose, and she told him he was borderline insulin resistance on the path to becoming diabetic. And she's honestly changed his life for the past few months. And she also opened a longevity clinic in Westchester where she offers a lot of the very new treatments, you know, that help us boost collagen, I guess reset our cellular level. So a lot of the things that people talk about, but she's done a lot of screening and she has a lot of evidence on things that have worked. So I think this is amazing. And Dr. Lee has a lot of experience in cardiovascular health. She was actually looking deeper onto the effects of Ozempic and other GLP-1 drugs, and especially the effect on women. And what she's building, which is, I think, revolutionary, and it's part of some of the stuff we talked about, is a community-based, let's say, collaboration group where women get, treatment and diagnostics, and she can talk more about it. It's in stealth mode right now, but the goal is to scale it a lot, and exercise is one of the pillars. But as we've seen, everything is holistic and integrated. So I think these two are working in the forefront of innovation. I do think there's a lot of disruption to come, at scale, and I hope that we all have a role in making this happen. But I would love to honestly just sort of walk the talk in community, and hopefully Alexi can share a Google Sheet or something with all of our names and our LinkedIn profiles and maybe our email addresses. So those of us who want to keep connecting and discussing, I think would be great if the team could help do that.
It's wonderful.
Especially because I'm seeing a lot of emails on the chat, and I'm like, oh my God, how can I talk and take note of all these emails? So
well, I think Alexi can help with that, Anna.
Okay.
I know I see the comments, and you will later, but this has been a crazy, amazing thanks to Simin and Poonam and your fantastic moderation, Anna. So thank you. I just wanted to say before we do sign off, and those who want to continue certainly can, but I know people are jumping off. If there are others in the group that would like to host a panel, moderate a session, please reach out to me. You can do that in the WhatsApp group or via email or via Lexi. And we're more than happy to have people, but Anna set a very high bar, so be prepared for that. But thank you again. Thank you very much.
Thank you.
Thanks, everyone. Have a wonderful day.
Thank you.
Thanks,
Bye.
Jagrudi, for having us here. It was fantastic.
Thank you.
Jakari, can you stay on for 1 second? I just want to ask a quick question. Maybe as a follow-on, we want to highlight